Did you know that Institut Jantung Negara is also the only medical institution in Malaysia that offers 3 types of valves for transcatheter pulmonary valve implantation? Let's take a look at this cutting-edge and innovative procedure.
The conventional method of pulmonary valve implantation is via surgery. So it means that the patients that require valve implantation in the past, they have to undergo open heart surgery, and the surgeon will lead the procedure and open up the chest and put the heart on the heart and lung machine, and the pulmonary valve is replaced.
There are 4 valves in a normal heart, 2 on the right side and 2 on the left. The pulmonary valve controls the blood flow from the right ventricle into the lungs. So, what are among the heart conditions that require TPVI?
The dysfunctional valve can be divided into 3 conditions. So the first one is basically the native pulmonary valve, which is the valve might be narrowed, or what we call atretic, means the absence of pulmonary valve when the child or patients at birth. And this group of patients require the initial pulmonary valve balloon valvuloplasty, or in a more complex lesion, they require the conduit placement from the right ventricle into pulmonary artery or the lung vessel. So this is basically in the more complex lesion. So the third group is those who had previous surgery and the new valve is implanted, and the new valve is basically dysfunction and require a new valve to be implanted.
Left untreated, pulmonary valve disease can lead to heart arrhythmia or abnormal heart rhythm, right heart failure, and even death, making the TPVI procedure a life-saving innovation. Before undergoing the procedure, patients must have an echocardiogram to evaluate their heart function. They may also require a computed tomography scan, cardiac magnetic resonance imaging, or cardiac catheterization. Additionally, coronary compression testing is usually conducted to ascertain if the valve will compress the coronary artery, which is a risk associated with this procedure.
After all this investigation, we will set the MDT, the multidisciplinary meeting, to discuss the suitability of the valve implantation. So, when the patient is ready for the procedure, most of our patients, the procedure is done under general anesthesia, and we need to puncture the femoral blood vessel. This is the vein, the big vein that connecting into the heart chambers, and the valve is delivered via the catheter, which is placed into the required location.
IJN offers 3 types of valves: the Melody valve, the Edward Sapien valve, and the venous P valve.
Usually, the Melody valve is implanted in those patients who had the previous surgery. So, the previous surgery can be a conduit surgery or the previous valve surgery. So, this Melody valve is implanted in the stented conduit or implanted in the previous dysfunction valve. So the Edward Sapien valve is a bit bigger as compared to Melody valve. So the size range is also different. So this valve is basically implanted in the 2 conditions. One is those with a previous conduit surgery, and the second one, we can also implant this valve in the native RVOT. So those who without the conduit, but there is a narrowing of the right ventricular outflow tract. The third valve is basically the venous P valve. This is the largest valve of all. This is the self-inflated valve. This valve is basically meant for large RVOT. The landing space is much bigger as compared to the other valve. This valve is not suitable for the conduit. It's only suitable for those with native RVOT, either in patient with previous abnormal valve which was opened via balloon valvuloplasty when the child was small, or the patient has undergone previous valve surgery, and that valve become dysfunction and required a new valve to be implanted.
While the Melody and Edward Sapien valves are made from bovine sources, the venous P valve is made from porcine tissue. For Muslims concerned about the origins of the venous P valve, discussions can be arranged at IJN.
If the parents insisted to know a bit more, especially when involved the hukum or Muslim, we will call our counselor, our ustaz, usually will join us in the discussion and explain on the hukum of having the porcine valve in their heart.
So, are there side effects to TPVI?
So the long-term side effect or the long-term complication of this valve is infection. So all the patients that require TPVI has to undergo a dental clearance. So they have to make sure their denture is basically free of infection, or patient may require antibiotic prophylaxis before the procedure. And of course, they have to take care of their teeth even after the procedure. So all patients will require antiplatelet like aspirin or clopidogrel. This is basically to prevent blood clots at the valve leaflet.
Still, compared to open heart surgery, TPVI is a less invasive procedure with no surgical incision. It also has a quicker recovery time and requires a shorter hospital stay. Indeed, with this revolutionary procedure, IJN continues to solidify its position as Malaysia's leading heart hospital that continually sets new standards in the medical field. Theevya, Ragu and Sheela Vijayan, FMT.